Hi, I'm Dr. Ronnie Spudich. I have a degree from the Yale University School of Medicine, and I completed 2 years of surgical plastic surgery training before I came to work with Dr. Maas about a year and a half ago here at the Appearance Care Center at the Maas Clinic. There are many options for resurfacing. Some of this is light chemical peels, which involve no downtime for the patient. That works really well for people who have busy schedules and who do not have time to sort of hide out while their skin sloughs off, which is what happens with some of the deeper procedures. And there's a number of very nice options that we have: glycolic acid peels, salicylic acid peels, and other acidified amino acid peels, which are applied. A patient would come in, sit in this chair, relax. There's a bit of a spa-like atmosphere. Over here on this counter is an example of the glycolic acid peel that we offer. I do these peels, as do the nurses and the physician assistants who work here. And these are very nice for just refining the skin texture. They're a great adjunct to your normal everyday skincare.
I'm careful about what I bring into the practice. I first of all want to make sure I'm not going to wait till the cows come home to get some new technology. If it makes sense, if it works, I'm going to bring it in. But for example, with the fractionated laser resurfacing, there was some earlier technology where people had to get several treatments to get a good result. I won't mention the names of these fractionated devices, but the newer ones, the CO2-based active and deep FX, means a person can come in and get fractionated laser resurfacing and get a good result with one treatment and one recovery time, where some of these older fractionated techniques, they had to come in for 4 or 5 different sets of treatments to get that. People don't want to do that 4 or 5 times and have recovery.
For someone who comes into me, however, with both pigment from sun damage, for example, and also is complaining of deep lines, wrinkles, skin texture, acne scarring, acne in general, and would like something that addresses all of these with a more aggressive treatment, something that they can really feel like something was done at the end of the day. The 2 great options for that are both more medium to deep chemical peels or fractionated carbon dioxide resurfacing. This here is the fractionated resurfacing machine. The benefit of doing the fractionated resurfacing, it's one of the newer technologies available, is that the downtime is much less than for a chemical peel. The whole idea of fractionated resurfacing as opposed to a chemical peel, which treats every millimeter of your skin, is that you're treating a fraction of the skin surface. And you can adjust, depending upon what head you use on the machine, the depth of the treatment. So we can go and treat at the same setting someone with what we call, this is called the Active FX machine, and we can set it for something called Deep FX, which we can first use, for example, for people who have very deep perioral lines, those deep sort of smoker's lines around the mouth, for example, or deep lines around the eyes, and we can go and treat that first, and then go ahead and treat the rest of the face with the Active FX portion, which is for a little bit shallower lines that are sitting in the face. Another wonderful thing about the Active FX machine, many of you have probably heard of Fraxel, which is another fractionated resurfacing using a different kind of gas called erbium, is that 1 Active FX treatment is equivalent to 5 Fraxel treatments. So instead of 5 treatments where you're waiting 5 days to recover from each of them, you just have the 1 treatment where you only wait to 5 days in total. This is the head that we use when we're treating patients with the Active FX. It takes about 15 minutes total. We would anesthetize you with some local anesthesia, and you would sit in the chair, and we would do about 40 or 50 pulses over your entire face. Again, it takes about 15 to 20, maybe 30 minutes, depending upon if we're doing the Deep FX as well. You would have about 5 days of downtime, during which time you're applying an occlusive dressing that we would provide for you. At the end of that, all of the sloughing of skin should have occurred, and at that time you can apply makeup again and go back to work, and the process of collagen regeneration, etc., will continue for about 4 to 6 months. So once again, this is an excellent treatment for people with both pigment from sun damage over the years, which many of us have, and also for fine lines, deep lines, acne scars, all one shebang. So we're big fans of Active FX here in this office.